South Dakota voters will now only decide on one Medicaid expansion-related initiative come November. Yesterday, the activists behind initiated Measure 28 dropped their efforts. Instead, they're now throwing their support behind Amendment D.
State House reporter Austin Goss explains what was behind the decision from our peer newsroom.
Supporters of a Medicaid expansion in South Dakota have rallied around one effort, Amendment D.
We're glad that we're all on the same page here. We think that a constitutional amendment is the best path forward to ensure that this happens, and we're grateful that everybody is working together on one ballot amendment.
Monday, Dakotans for Health co-chair Rick Weiland asked the Secretary of State's office to withdraw initiated Measure 28 from the ballot. Those favoring a Medicaid expansion in the state feared voters may confuse the two efforts.
One measure on the ballot, not two, that basically accomplish the same thing, except the constitutional amendment is better protected by meddling. Knowing that it was all about the people we're trying to help, it was a pretty easy decision to make.
Dakotans for Health had made the argument that an initiated measure had a better chance of passage. Historically, initiated measures have had a higher success rate in South Dakota than amendments. However, Weiland says that concern isn't as prevalent now.
Confident, never comfortable, confident that combining our efforts behind one measure to expand Medicaid is the way to go.
Ultimately, both organizations, which have the backing of all three major healthcare providers in the state, say they're now focused on the push to November.
42,500 of our friends and neighbors are going to be able to access affordable care, right? 1.3 billion of our tax dollars coming back to us into the state, and we're going to save the state $63 million over the first 2 years of the program. All good things, all things that are going to be accomplished when we pass Amendment D.
Voters in November will now decide on a constitutional amendment for Medicaid expansion and an initiated measure to legalize recreational cannabis. In Fort Pierre, Austin Goss, Dakota News Now.